Today we're going to be going over the vertebrae in the human spine. As you can see, these are the lumbar vertebrae. And we have 7 cervical, 12 thoracic, 5 lumbar, and 5 sacral that have fused together to make 1 sacrum and 1 coccygeal bone. Then you have different curvatures. You have a primary and secondary curvature, which is going to happen in the embryo state for primary curvature, and it's going to kind of be like this. It's like kind of curved, and that's going to be called kyphosis. Then as you get older, it's going to kind of come like this, and you're going to get a lordotic curve, and it's going to be a secondary curvature. So then we're going to go over the cervical bone. So all cervical, mainly 3 through 6, are going to be called typical cervical, and they're going to have all these parts on it, even the atypical cervical. So we have our transverse foramen. Any hole is mostly going to be a foramen. So this big hole is going to be called your vertebral foramen. Then this part right here is going to be called the body. Then you have like these little lips here. They're going to be known as your lips of Luschka or your uncinate process. So the next thing that we have on a cervical, we have our anterior, because that means front. So you have your anterior costal bar, your anterior tubercle, your costal lamella, your posterior costal tubercle, and then your posterior costal bar. Then you're going to have your superior articular facet. I kind of think of it like a face. It's kind of smooth here, because then on the other side you have your superior articular process. On the inferior side, or the bottom side, you have your inferior articular facet, and then your inferior articular process. So on the body, right next to it, is going to be the pedicle. So I always think PB. So next you have your lamina right here, and that's leading up into the spinous process. And on the cervical, you're going to have the bifid spinous process. And the last thing is going to be our transverse process, which is going to be on the side here. And that really is the main things of the cervical vertebrae. So our next is going to be our thoracic vertebrae, and the typical thoracic is from T2 to T8. And it's going to have everything just like the regular cervical, except the spinous process isn't going to be bifid anymore. It's just going to be one long piece. But then if you'll notice here, you have these little grooves here. So these are going to be your transverse costal facet, because that's kind of where the rib is going to be attaching, or the body of the rib is going to be attaching, because then over here you're going to have your superior costal demifacet and your inferior costal demifacet, and that's where the rib head and neck are kind of going to be attaching. Now the lumbar is always going to be the biggest, and as you see here, it's the same thing. You know, you have your body, pedicle, lamina, transverse process, but then the things that are different here is we're going to have these little bumps here. So you think of it as map, right? You have your mammillary transverse process, you have your accessory, it's just mammillary process. And then you're going to have your accessory process, and then you're going to have your transverse process. So people think of it like this looks like a moose. This looks like a giraffe almost. And this one is just kind of the smallest of the bunch. So that's how you always know that this is cervical, because they're smallest and they have the lips Alushka. So those are kind of the dead giveaways. So next we're going to work on the sacrum here. So sacrum is all the way at the bottom. So we have our superior articular facet. We have our superior articular process. Now on certain types of cervical, not in this one, you'll also have an inferior articular facet and our inferior articular process. But we have our base, which is going to be this, not a body anymore. Then you have this kind of part that kind of sticks out. So that's going to be our sacral promontory. Okay? And we're on the we're on the anterior side. So here we're going to have our sacral bodies. So these are, each one here, these are like the vertebrae that all fuse together. So these are segmental bodies of the sacrum. These holes here are going to be, instead of foramen, they're going to be foramina. These are going to be our posterior sacral foramina of the sacrum. So this is our base. This is going to be the apex here, because then this here becomes our coccyx. And these little bumps here are going to be our cornu of the coccyx. And these are going to be the cornu of the sacrum. So then up here, right, this hole up top is going to be the sacral canal. And there's usually going to be a hole at the bottom here. And that's going to be our sacral hiatus. So you like to orientate yourself so that way it's easier to go about when you're looking at it in lab. So right here we have our sacral median line, right? It's in the middle, median. So then coming next to it, you have your sacral intermediate line, or either one will work. I say line, some people say crest. So sacral median crest, intermediate sacral crest, and then you have your lateral sacral crest. And then if you see here, it kind of is coming down, and then an angle forms. So that's going to be our lateral sacral angle. You know, if I can get my hand in there, kind of coming out. So next we're going to have our sacral tuberosity. So it's a little bit rougher. And this kind of looks like a human ear. So it's going to be our sacral, or our auricular surface of the sacrum. And because we're on the anterior side, we're going to have our anterior sacral foramina. And then this part right here is going to be the ala of the sacrum. Let me just check and see if I missed anything. Now, so that's kind of the whole gist. Okay, next is going to be our atypical vertebrae. So we have our C1, which is going to be called our atlas, because if you think of the superhero Atlas, he holds the weight of the world on his shoulders, and this is holding our skull, which is going to be holding the condyles of our skull. So we have our lateral masses, which is the whole thing here. We have to find out where the anterior and posterior side is. So this little fovea dentis here is how I tell that this is the anterior side. So this is going to be our anterior arch, really. Then you have your anterior tubercle. Then if you go to the posterior side, you have the posterior arch and the posterior tubercle. Then you're going to have your groove right here for the vertebral artery and the first cranial spinal nerve, which is going to come in here. So that's mainly all the parts of the atypical C1 atlas. Then we have the C2, and that fovea dentis is going to attach here into the articular facet of the den to kind of give our head the rotation that we need. So this whole piece here is going to be called the den. And then you're going to have a little focus. It's not really good to see here, but you're going to have little indents here. And that's going to be the odontoid process and its articular facet. So this whole thing is the odontoid process, or the den, and these little indents are going to be the articular facet. And like I said, they're going to have all the same parts as the typical vertebrae, right? So you have your transverse foramen, our transverse process, our superior articular facet, the body right here, the bifid spinous process, the lamina, the inferior articular facet, and the vertebral foramen. So that kind of is covering all of that. Now, I don't have them on me, so we're just going to use a typical, well, this might actually be T1, because T1 is also going to have maybe the lips elustra here. So what they're going to have is they're going to have a full costal facet on top, and then an inferior costal demifacet, okay? And that's going to be for T1. And then you have T9, 10, 11, and 12. So T9 is only going to have the superior costal facet. And mainly here, as we can see, the cartilage of the rib, right? How these are fusing into here. So here's 1, 2, 3, 4, 5, 6, and 7. So see, 7's attaching here, and it's coming all the way up. 8 is coming here, and it's fusing with 7 to attach to the sternum, and 9 is doing the same thing. So that's why 9 is going to have the superior costal demifacet. And when you get down to the false ribs or floating ribs, like T11 and T12, they're only going to have a full costal facet. No inferior, no superior, and that goes with the same thing with T12. So now we're going to go over a couple ligaments. So this is our intervertebral disc. It's inter because it's in between the vertebrae. So the outside here is going to be called the annulus fibrosus, and the inside here is going to be the nucleus pulposus. So we're going to have an anterior longitudinal ligament. I wish I had my spine, but so the anterior longitudinal ligament is basically what it sounds. It's running on the anterior side, and it's long, so it's going to go all the way up the spine. Then you'll have the posterior longitudinal ligament, and that's going to run inside here on the vertebrae, and it's running all the way up on the posterior side. So then you're going to have your zygapophyseal joints with your articular capsule, and that's going to be, so these right here are like your zygapophyseal joints, right? So if there's a ligament wrapping around this, that would be the zygapophyseal joint, right, in here with the articular capsule. So then you're going to have your ligamentum flava, and they run in between the lamina. So it's going to go from this lamina to that lamina here. Okay. Oh, so from this lamina to that lamina. Then you're going to have your interspinous ligament, right? So these are a spinous process. So inter, in between your spinous process. So interspinous ligament will be running through here. Then you're going to have your supraspinous ligament, and these are going to go over the top of the spinous processes. So then you have your ligamentum nuchae, and unfortunately I don't have the rest of it, but that is only going from C7, right, so our cervical vertebrae number 7, to the base of the skull. And then you have your intertransverse ligament. So remember, these are a transverse process. So these are going to go from here to here. So our intertransverse ligament. Now we have our lumbosacral joint. So come over here, right? Here's our lumbar. Here's our sacrum. So this is going to be the lumbosacral joint in here, where they're kind of meeting. So then you have your ilio-lumbar ligament. So that's going from the lumbar to the iliac crest. So that's why it's called the ilio-lumbar ligament. And then you're going to have your zygapophyseal joints. So that's going to be like right in here, right? Because there's your zygapophyseal joint with your articular capsule. So then we're going to move on to the sacral coccygeal joint. So we have our sacrum and we have our coccyx, which is usually going to have a point here. So our first one is going to be our ventral sacral coccygeal ligament. So that's, so it's in the front here, and that's going to be a ligament that's coming down here. So actually, it's going to be a ligament that's coming from here, from our sacrum to our coccyx. Okay, and then you're going to have the dorsal, and you can see here, it's kind of showing the ligament. It's going to come from here down to your coccyx. And then you're going to have the lateral sacral coccygeal ligament. So lateral, right? This is our lateral angle. It's going from here down. And then you're going to have your intercornual ligament, and that's going to be, right, inter is always going to be in between. So our intercornual ligaments in between the two corners. Our next thing is going to be talking about the atlanto-occipital joints, our axis and occipital, and our atlanto-axial joints. So this is the base of the skull. This is our atlas. This is our axis. So our first thing is our anterior atlanto-occipital membrane. So that's going to be, if there was like a piece of tape or something right here, that's going to be our anterior atlanto-occipital membrane. So if you turn around, backside, posterior atlanto, right, atlas, occipital, atlanto-occipital membrane. Then you're going to have your articular capsules, so they're going to be wrapping around here. And then you're going to have your lateral atlanto-occipital ligament. So lateral is going to be over here. So next we have our axis and our occipital. So I'm going to be looking in. It's going to be a little bit harder to see this stuff, but I'm going to try my best. So we have our tectoral membrane. So remember our posterior longitudinal ligament, how it's coming inside here and it's coming up. Well, that eventually stops at C2 here. So this one here, it's going to stop. And then a new ligament, or a new membrane, or a new name, it's going to be called the tectoral membrane. So it's going from C2, and it's coming all the way up here. Then you're going to have your alar ligaments. So our alar are coming from the den of our axis all the way to our occipital part inside here. So they're going to go off to the side. They're like little check marks, you know. Then you have our apical ligament of the den. And apical means top. So it's coming from the den to the top of the occipital. Next, we have our atlanto-axial joints. So our atlas and our axis joints. So we have our lateral atlanto-axial joints. We're going to have our median atlanto-axial joints. We're going to have the articular capsules, so they're just going to, cover these. We're going to have our anterior atlanto-axial ligament. So that's going to be on the front side here. Anterior atlanto-axial ligament. You're going to have your posterior atlanto-axial ligament. Then my favorite one is going to be the cruciform ligament. So you're thinking of a cross, right? So that's going to be in here, and it's coming up, and it's coming sideways, like a cross. So the sideways, what we call things that are sideways in anatomy, is going to be called transverse. So we have your transverse atlantal ligament that's coming in here. Then you're going to have your inferior, it's going to be below, inferior longitudinal band. And you're going to have your superior longitudinal band. And that is really going to be the gist of all the ligaments and joints from the occipital, atlas, and axis. Next, we get to move on to the fun stuff. I actually don't really like the ribs. They give me a hard time for some reason. But ribs 1 through 7 are going to be our true ribs, or our typical ribs, okay? So this is going to be 3, 4, 5, 6, 7. This is going to be rib 1. This is going to be rib 2. So we're going to talk about our typical ribs 3 through 9. So we have our dorsal side, and we have our ventral side. Okay. So the first thing here is going to be called the body, or the shaft. It's the longest part. Then you're going to have your superior and inferior borders. I'm just trying to orientate myself here. Next is going to be our head, and then our interarticular crest. So you see this little pointer. You see this little line here, right? This is going to be in between the two articulations of the rib. So that is why it's called the interarticular crest. Then you're going to have your articular facets here. You're also going to have, so this is the head, this is the neck, this is the body. So we have our tubercles. So we're going to have our non-articulating part, and that's going to be farther away from the head of the rib. So it's going to be here. And then you're going to have your articulating part of the tubercle, which is going to be here. And then you're also going to have your costal angle. So that's pretty self-explanatory. It's just the angle going right here. So our next one is going to be rib 1. And you're probably thinking, how can you tell if it's anterior, if it's posterior? So the anterior side is going to have kind of this more textural side of things, while posterior side, even though it has texture, it's a little bit more flat, and you can really tell and see it when you're holding it. And there's like a big groove right here. So our first thing that we're going to have, right, we have our head, our neck, our body, our angle. So the part closer to the head of the rib is going to be our groove. There's a little groove here for our subclavian artery. We're going to have an attachment point for our scalene muscle. This is going to be called the scalene tubercle. And then we're going to have our groove for the subclavian vein. And that's going to be the main things that are important on rib 1. Next is going to be rib 2. So like I said, posterior side. Give me a second, sorry. No. So you can see here a lot more detail. So this is our anterior side. Here's our posterior side. Really flat, no bumps. So here, the main thing that we have on here is going to be our tuberosity, right? It's a little bump for our serratus anterior, which is another muscle in our neck. Now how it attaches here, right? So here's our head, our neck, everything else. So it's going into the thoracic vertebrae like this. And like I said, there's your interarticular crest. Here's our articulating parts, because they're articulating with the superior and inferior costal demifacets of the thoracic vertebrae. And there's the articulating part. So that's how it's going to fit in there, and that's how your ribs are in your body. So our last thing that we're going to cover today is going to be our sternum. So this whole thing, don't worry about this, but this whole thing here is going to be our sternum. So first we have our manubrium of the sternum. Then you're going to have this part here is going to be our jugular notch on the sternum. And then you're going to have where your clavicle attaches on either side is going to be our clavicular notch. Then you're going to have your sternal angle. So if you could see here, there's kind of a bump right here. And sometimes if you stretch in the morning or wake up or throughout your day, you'll hear like a little crack in the front part of your chest. And that's going to be this part kind of releasing air or pressure, because it usually doesn't finish fusing until you're about like 33 or in your mid 30s. So next we have our sternal body, right? So this whole thing is going to be the body of the sternum. Then you're going to have your xiphoid process, and there's a little part here that's being covered up, and that's going to be our xiphi-sternal junction. I think I missed the costal notches. So see these things, these are costal. So these are where your vertebrae attach. So if this was in here, you would see notches all throughout here. And that's going to be your costal notch of the sternum. And that is everything that we had to go over.